The fluoroanatomy is different than the anatomy, because the x-rays, when they go in a vertical position, that's what the picture is. So it is possible that if you don't know really how to see in the fluoroscope what you're looking in your back, you may injure something else. Then the third thing you also have to know, other than anatomy and fluoroanatomy, you also have to know how to maneuver the needle. Because the needle, sometimes the person is very big and the needle does not follow your instructions or your maneuverability. That your skill of maneuvering the needle is another skill you have to have in order to have a safe injection. So other than the expertise of the person who is doing the injection, you also need to have the person's specific problems. For example, if a person has a bleeding problem, no matter how skillful you are, you can injure a blood vessel and there's no way to stop that blood. So make sure the blood thinners are stopped. And sometimes there are some unknowns in a person. Similarly, the people can have a very hyperactive sympathetic system, and a mild sedation is necessary, otherwise they can go into vasovagal syndrome. The heart rate suddenly thinks because of the threat stops, and that can cause the problem. The blood pressure goes down. Also, the medication can get into a vessel, and that can also cause some problem. However, all these things can be minimized if the person who is doing the procedure properly screen the person for all these things, give proper instructions, make sure that the person is comfortable with the procedure, explain all these side effects to the patients, have an informed consent about that. Of course, things could happen. Nobody is going to guarantee that everything we do in medicine is safe. Even the medication you take orally is not safe. But safety part has to be explained to the patients, that what are the advantages, what are the limitations of these injections. Now, these injections are not all treatment. It is part of a treatment. Once your pain is better, still a lot of things has to be done.